I'm Jessica Mannion with My Healthcare Direct, and in today's video, I'm going to show you how you could quote and self-enroll in a Part D prescription drug plan using an agent-assisted enrollment link. Now, this link is also available on our website at myhealthcaredirect.com. Now, before you get started, the first thing I want to make sure you see is in the upper right-hand corner, you should see my name listed. When you click on my name, it should have my telephone number and email address, so all my contact information. So if you have any questions about anything, feel free to reach out to me and I'd be more than happy to help. Okay, so let's get started. The first thing you're going to want to do is type in your zip code. Now, before you hit View Plans, make sure that your correct county is listed because there are some zip codes out there that have multiple counties, and there could be different plans depending upon what county you're in or even different prices. So you want to make sure you're clicking on the correct county before selecting View Plans. So in this case, I only have one county. That's the correct one, so I'm going to hit View Plans. Now from here, you're going to see 4 different tabs. You can see one for Medicare Advantage prescription drug plans, also known as MAPD plans. Medicare Advantage plans, which are just Medicare Advantage with no prescription drug benefit to them. And then you can see prescription drug plans only and Medicare supplement plans. For the most part, you're going to ignore Medicare supplement plans because as you can see, there's not a whole lot and it doesn't actually give you any pricing. So if you wanted a quote for a Medicare supplement, give us a call and we can give you a personalized quote. So let's say I'm going to look for a prescription drug plan. I'm just going to click on that section. So immediately you can already see all the plans in your area with the carriers that we work with. Now, if you're not taking any prescription drug plans, then you might be able to just sort these based on your annual cost or what you're going to pay monthly for the plan. However, if you're someone who is taking a prescription, you'll want to make sure to put that information in first before deciding which plan might be right for you, because the first one that comes up might not be the best one depending upon what you're taking. So we're going to go ahead and add in a drug and see what plan might be best for us. So you're going to go over here to the Add Preferences button and you're going to select it. Now you're going to click on Prescription Drug. And this will bring a drop down where you can select whether you're getting any extra savings from Medicaid, Social Security, or a Medicare savings program. If none of these apply to you, you're going to select no, that you're not eligible for any extra help. Or if you simply don't know, then just select I don't know. But let's say I know I'm not eligible for any extra help. I'm going to hit that and hit continue. Here is where I'm either going to type in my prescription manually or I can connect it to my Medicare.gov account. If you're taking multiple prescriptions, you don't feel like typing everything, you can connect it by logging into your account or you can just type it in manually. So because I'm only taking one prescription, I'm just going to go ahead and type it in. So as you start to type in the prescription, you should see it pop up in the drop-down menu. So just make sure that you select the correct one. Then it'll show you the dosage, quantity, and frequency of the prescription. So I'm just going to pick the correct dosage. Let's say I only take it once a day, so I would get 30 per month and hit add. And let's say that's the only prescription I'm taking. I'm going to hit continue, and it's going to then take me to a pharmacy lookup. So let's say after these first couple of pharmacies I see, I don't see the one that I have, I can always type the name in here and hit search. So I did see Publix, but let's say I didn't see Publix. I can hit search and the closest Publix to my zip code will pop up. I'll hit add. Let's say I have another pharmacy that I may use depending upon where I am. I might use CVS. I can select that as well. And when I scroll to the bottom, I can see that Publix is listed as my primary pharmacy. But if I wanted CVS, I can always switch to CVS too. Hit continue. There's no other preferences to select, so I'm going to hit continue. And then it should come up with a list of all of the drug plans. So the one that's saying it's going to cost me the least is going to be this Aetna plan. So when I get to this page, I'm going to hit total estimated cost. I don't ever sort it based off of a preference score. I look based off of your total estimated cost. This includes your prescription drug cost as well as the monthly premium to having the plan. So on atorvastatin, it is saying that this SilverScript plan is going to cost me the least over the course of the year. So I want to get some more information on this drug plan. So you're going to hit Plan Details. And here's where it's going to list all of the details of the plan itself. It's going to tell you what the monthly premium is, which you saw on the previous screen. You'll see here the annual deductible. Now this is one of the few plans where you will have a deductible of that, well, in this case $480, that you'd have to meet if you had a tier 2 drug or higher. Most drug plans you don't have to meet a deductible until you get to a tier 3, but on this one it's tier 2, and maybe that's one of the reasons why it's more affordable. But that's something you want to definitely take a look at. Then you can see that Publix is a preferred pharmacy. So there's two types of pharmacies. There's a preferred pharmacy and a standard pharmacy. With a preferred pharmacy, you're going to get your prescriptions at a potentially lower cost than if you went to a standard pharmacy. So it's going to tell you, if I got that same drug at a preferred pharmacy, it would be $1 for a tier 1. If I went to a standard pharmacy, it would be $19. So you can bet that I'm going to go to a preferred pharmacy versus a standard. It'll also give you mail order pricing as well, which is always in a 3-month supply. You can also pull up the formulary. So let's say your doctor wants you on a new medication, but you really want to know on your current drug plan what that cost would be. You could go to the formulary and type in the drug's name. It'll tell you the tier that that drug is. So then you can compare it to these numbers and you'll have an idea of what you'll be paying for that prescription. Now, if you want to see how the prescription is covered on your plan, if you scroll all the way to the bottom, you can see that yes, atorvastatin is covered, and that both of the pharmacies that I use, Publix and CVS, are in-network pharmacies with preferred pricing, meaning you're going to get a much better deal if you go there versus a standard network pharmacy. So if I want to know exactly my cost with atorvastatin on this plan, I'm going to hit the prescriptions tab, and it's going to tell me I'm actually on a tier 1 drug. If it was a tier 2, 3, 4, 5, it would be listed underneath one of these. However, it's tier 1, so it's listed under the tier 1 name. It's telling me that I'm only going to have to pay $1 for the drug because it's a generic. So I expect to pay a total of $10 for the year for that prescription if I get it once a month, which is where this number comes from, the estimated drug cost. So this just breaks down the cost of that drug. I don't have any non-covered prescriptions, so that's why that's X'd out. And then for total cost, this will break down between the monthly premium and the drug cost what you will be spending monthly on your drug plan. Now let's say I looked over all this and I'm really liking this price. It's very affordable and I won't have to pay much for my prescription, so I want to enroll in this plan. You're going to click the yellow Add to Cart button, and you're going to see the plan listed right here. Now let's say you wanted to go back and view the details again, you can click on that link, or say you had a change of heart and you wanted to change to a different plan for some reason, or if you just wanted to remove it from your cart altogether, you can hit remove and this one will drop away and you won't have anything in your cart. But I'm going to go ahead and enroll in this plan. This one I want for myself. It's going to tell you that you're going to be redirected to a carrier form where you're going to complete your enrollment in the SilverScript plan. So you're going to hit continue. Now is where you're going to select your eligibility. So typically there's only certain times of the year where you can enroll in a prescription drug plan. The most common one is during your initial enrollment period. So now you're at a form where you have to select when you. So here's where you're going to have to select your eligibility. Now there's typically only certain times when you can enroll in a prescription drug plan. One of them is when you're going through your initial enrollment period, which is that 7-month window of 3 months before you turn 65, the month you turn 65, and up to 3 months after you turn 65. Or you can enroll during the annual election period, which runs from October 15th to December 7th. And that's where you can also change your prescription drug plan from year to year if you're already on Medicare. So in this case, I'm going to say that I'm just turning 65 and I'm going on to Medicare the first time. But as you can see, there's a lot of different reasons that you could get on a drug plan or switch to a different one. But in this case, I'm just going to say that I'm new to Medicare, so I'm going to select that box. And I'm going to request that the coverage starts on March 1st. And then anything with a red asterisk, you're going to need to fill in. Anything that doesn't have the red asterisk is optional. You don't have to put it in. So I'm just going to fill in everything that it's asking for that I do have to put in. So I'm going to put in my name. Let's say I was born March 15th, 1957. I'm a female. There's no asterisk here, so I'm going to skip that. I do have to put my address. Now, if you have a separate mailing address, like a P.O. box you want to use for all of your mail, you can select yes and put in that address. Otherwise, if your resident address is the address you want things mailed to, you can select no and hit next. Now, when you get to this page, you're going to have to start putting in your Medicare information. So you're going to want to grab that red, white, and blue card and look for the Medicare number, which are those 11 random letters and numbers. And what's really neat is this provides you a visual example so you know where to look. So you're just going to go ahead and type that in this box here. And don't worry about putting in any dashes. Just type in the number and letters as you see them. And then you can put in your Part A and Part B effective dates, which will also be listed below your Medicare number. And then once you fill that out and keep scrolling, a lot of people, they very rarely will hit yes unless you have VA benefits or TRICARE or some type of employee health benefit. You'll hit no, that you're not going to have any other drug coverage. No, if you're not in a long-term care facility. You're going to pick which language you prefer. Some people may prefer Spanish or English. And then for the explanation of benefits, you can either select that you want it received electronically, say through an email, or if you want it in the mail. So if you do want it emailed to you, make sure you put in your email address both times on this box and the box below it. Or if you want to receive it in the mail, which a majority of people tend to do, you just select that you would like it in the mail, hit next. You'll then have to put in what type of payment that you would like to use for the monthly premium, since this drug plan does have a monthly premium of $7.70 a month. That'll be in the next step. And then you'll finally review the information and submit the application. And that's pretty much it to enroll in a drug plan. Now, I obviously couldn't go to the next step because I'm not Medicare eligible, so I don't have a number to put in here. So if you get stuck on any of these steps, feel free to give us a call and we can help you with any questions that you may have. I hope this video was informative and helpful, but again, like I said, if you need anything or have any questions about this process, or if you wanted to discuss Medicare Advantage plans or Medicare supplement plans, feel free to give us a call and I'd be more than happy to help.